Welcome to Mile High Living, the slightly abbreviated edition. I'm Gina Bellich. Well, if you struggle with burning pain or tingling in your feet, Front Range Medical Center's chiropractor can help. Earlier, I spoke with Dr. Dean Anderson via Zoom. Dr. Dean, thank you so much for joining us. Why don't we start off by just describing what is peripheral neuropathy?
Well, Gina, it's damage to the peripheral nerve. So these are nerves in our extremities. Most commonly, it affects the lower extremities. So it'll start off in the ball of the foot or the toes. As it progresses, it'll work its way up towards the knees. But again, peripheral neuropathy is damage to these peripheral nerves.
So what exactly causes this?
Oh, there's a number of things that can cause it, Gina, but the most common cause are blood sugar problems like diabetes or even pre-diabetes. But in addition to that, we see a lot of patients who have neuropathy because of underlying autoimmune issues they may deal with, or it's secondary to a chronic inflammatory issue they have. A neuropathy can also be side effects of certain medications, chemotherapies, long-term use of statin medications, chronic use of antacids. So there's really a long list of things that can cause it, and that's one of the most important things to understand in the beginning is why.
So now, what can you describe a little bit then about what your patients are actually dealing with when they're having to go through this?
Yeah, so usually as we're seeing patients, there's just a lot of frustration because they have pain. You know, it's burning, sharp shooting electrical pain, so it's difficult to sleep at night. Hard for patients to be on their feet and enjoy hikes or walks or social activities. A lot of numbness, so patients have issues with balance or they don't feel comfortable driving. In addition to the frustration, Gina, I see a lot of patients who just feel hopeless because they don't know what to do. They don't know where to turn because oftentimes they've been told nothing can be done for them. So it's really frustrating for these individuals.
Now, can long-term complications then develop?
Yeah, I mean, the most common things is just because of pain. It's just the negative effects on quality of life and then the mobility issues. And I have lots of patients who are fall risks. They don't have good balance because they can't feel things or they're not comfortable driving. So it's just this overall kind of cumulative effect on how it's affecting their lifestyle.
Can you describe basically how your treatment and how you take the way you approach this basically, because it seems fairly complicated, yet you've had much success.
Yeah, well, the reason we have success is twofold. Number one, we have an advanced treatment in our office. It's an electrical treatment. It's called electronic signaling treatment. What makes it one of the more advanced forms of electromedicine is that it incorporates really high frequencies and amplitudes of current. So with this treatment, we're actually addressing the issue, which is the nerve damage. So we reduce, the pain, the burning, sharp shooting electrical pain, or the numbness. We start to regain feeling. We reduce paresthesia. So this advancement in the treatment is allowing us to address the actual issue, which is the nerve damage.
So now, why are you so successful then when you really think about it? Because a lot of people come to you after other doctors or other people have told them nothing could be done.
Yeah, there's a couple things involved with this that I think allows patients to have success. One is this advancement in treatment that I just mentioned. But number two, Gina, what we do is very comprehensive. And what I mean by that is patients have neuropathy for a reason. So in the beginning, we spend a lot of time in making sure we know why they have it, and we address those issues, whether it's blood sugar issues, it's autoimmune issues, it's side effects of medications, because we want to make sure that when this treatment gets them better and we get rid of the nerve pain they have or we get rid of the numbness they have, we want to make sure it doesn't come back. And the only way that's going to happen is by making sure we also address the issue that's causing it. So it's really this comprehensive approach.
Well, you have many happy patients. Let's go ahead and listen to one of them.
When I first started coming to Dr. Anderson, I had no feeling in my feet. It was very, very difficult for me to drive a car because I couldn't feel the brake pedal anymore. What has happened since is absolutely fantastic. I no longer fear losing my balance as I walk. I have feeling in my feet and lower legs again, and driving a car makes me much safer on the roads than I used to be.
You can call 303-586-7897 and receive a $27 consultation that's normally $245. Now, the consultation includes a review of your health history, a neuropathy-specific evaluation, and a review of past records to determine if you're a candidate for treatment. So go ahead and visit denverneuropathy.com. Dr. Dean Anderson paid for today's appearance.